is Jennypher Fandino, and I'm a student at Kaiser University, the Lakeland campus. Today I chose to do my presentation on a new radiopharmaceutical, fairly new radiopharmaceutical called Dopamine I-123, also known as DAT-scan. Now, throughout my presentation, I'm going to cover numerous topics. Those topics are going to be exactly what is DAT-scan. I'm going to briefly talk about Parkinsonian Syndrome versus essential tremors. Then I'm going to go into how DAT-scan actually works in the body, followed by some of the indications and contraindications for the study, as well as a brief little nuclear medicine protocol for the study. And then I'm going to go over some safety information that we all need to be aware of. Now, at the end of the presentation, if anybody has any questions, I'll go ahead and do my best to try to answer them. With that being said, we all know that nuclear medicine can be dated back to over 60 years ago, and ever since it's been developed, we all know that it's always been on the front lines of medical advancements. Now, not only with technological advances, but also with the development of new radiopharmaceuticals. One of those new radiopharmaceuticals that has just been introduced is DAT-scan. And what this does is actually helps doctors evaluate patients with suspected Parkinsonian syndromes. And this is important because it's continuing to keep nuclear medicine on the front line of those advancements. Now, what exactly is DAT-scan? Well, DAT-scan is actually the first FDA-approved radiopharmaceutical that helps doctors evaluate those patients with Parkinsonian syndrome. When it was developed or approved back in January 2011, only 80 hospitals across the United States were given the approval. And the reason for this is because not only did they want to test it out first, but they also, DAT-scan is considered a Schedule II controlled substance per the DEA. So we also, before this is administered, the facility has to have the proper license to administer. Now, as I said earlier, what the purpose behind this radiopharmaceutical is to help the doctors distinguish between patients that are having symptoms related to Parkinsonian syndrome and also those associated with essential tremors. Now, in order to fully understand the purpose behind DAT-scan, we have to know the motive behind it. And we have to know what Parkinsonian syndrome is really about. And a lot of people have a misconception about this. Parkinsonian syndrome is not an actual condition. It's a term used to describe a group of conditions associated, which is mainly associated with Parkinson's disease. And those symptoms include tremors, slouch posture, also slowness in walking. And it's very important because these symptoms can go ahead and vary with different diseases. Now, Parkinsonian syndrome occurs when the brain does not produce enough dopamine. And like I stated earlier, one of the primary diseases associated with Parkinsonian syndrome is Parkinson's disease. And Parkinson's disease currently affects 1.5 million Americans each year. And it carries the main symptoms of Parkinsonian syndrome, which is the tremors as stated. Patients usually tend to have a slouch posture. They're very slow movement, and they actually get a loss of smell. Now, in order to understand the role of dopamine in the body, the role of dopamine in the body actually plays an important role because dopamine is actually a neurotransmitter that is produced in the brain. Now, just like any other neurotransmitter, it has different roles in the body, but its primary role is to help the function of the central nervous system. Now, the reason why this is so important is because without proper function of the nervous system, that's when you have your body and your limbs tend to kind of go out of whack. Altered levels of dopamine can lead to different symptoms, such as Parkinson's disease symptoms, which you get the tremors, or it can also, if you have elevated levels of dopamine in the body, you also can get ADD from it. Now, dopamine is actually produced naturally in an area of your brain called the substantial nigra. Now, although this area is located in the middle portion of your brain, it's located in a very important part. And the reason for that is because this area of your brain is actually responsible for most of your motor functions. Now, what happens is, in the substantial nigra, which is located once again in the middle of your brain, there are certain cells that produce the dopamine. Now, once the dopamine is produced in there, it kind of has its freedom to bounce around to different areas of the brain. However, all throughout its movement, the substantial nigra is controlling where it goes. Now, just like any other neurotransmitter, the dopamine tends to navigate to two specific parts of your brain. And those two specific parts of your brain are the cutate and the putamen. Now, in this area, once again, if it's not well regulated, your functions kind of go, you probably have the tremors occurring, and that's when your posture is incorrect. And when the substantial navia is not working properly, that's when you get the symptoms. Now, as you look at the image here, right here is where the substantial navia is located. And this, like I said, the cells in here produce the dopamine. And as you see, it has 3 arrows here, which are kind of like the little highways for the dopamine to go into. And right above, you have the putamen and the putamen, which is also known as the stratum, and that's where they tend to navigate. And then this is just another picture that shows what a healthy substantial navia looks like. As you can see, it's brown here. And a patient with Parkinson's disease pretty much has a diminished look to it. Now that we understand what Parkinsonian syndromes are, then we want to move on to what essential tremors. Now, essential tremors is actually the most common form of, is the most common movement disorder. It occurs in about 4% of the population over the age of 65. I know that's not a big number, but it just goes to show that 4% of those populations are affected by this. Now, they have the same symptoms as Parkinsonian syndrome, so what makes it actually different? Well, an interesting fact that I learned as doing this research, where in Parkinsonian syndrome, the symptoms occur without movement. In order to get a tremor and an essential tremor, you actually have to be moving that particular limb. So patients usually are reaching up for a ball, and that's when their hand gets that tremor. Whereas Parkinson's, as many of us know, the patient is sitting still, but yet they have a tremor in their arm. And this is just right here. Over here are some of the most common movement disorders, and there are 4 main symptoms that doctors look at. And as you can see, only 2 of these movement disorders, which are essential tremors and Parkinson's disease, have the main symptom, which is tremors, which is why it's so hard to diagnose this condition. Now, the reason why it's very important to get an accurate diagnosis is because both of these disorders are treated with medication. However, if the wrong medication is given to a patient who's experienced the opposite disorder, it can greatly increase those symptoms that it's having. And the way doctors go about in diagnosing these patients is they actually do the first step, which is run labs. They want to go ahead and rule out any other conditions, such as a thyroid condition that could be behind these symptoms. After they do that, they go ahead and they move on to doing neurological exams, such as testing your muscles for strength, also your balance and your movement. Now, after they do those tests, they go ahead and they move on to a CT or MRI exam. And the reason so is because they want to rule out any past brain injuries. Now, it's very important to know that scan isn't a tool used to it's not just a one test used to diagnose a patient with or without Parkinson's syndrome. The way I look at it is a piece to a puzzle. A doctor pretty much has to go through all these, and then they'll say, well, we're going to take this approach now, and we're going to do a DAT scan, which is after the CT and the MRI, they move on to nuclear medicine DAT scan. So now that we're familiar with all that, now let's explain, I'm going to go ahead and explain how DAT scan works. DAT scan has an active ingredient, which is the first part of the iflupin, which is iflupin, and it's tagged with I-123, which allows us to visualize it through the scans. Now, iflupin is actually a cocaine analog, and that's why I stated that the DEA has to have a special license. The facility has to have a special license for this. Now, just like cocaine, iflupin has an extremely strong bind and attraction to the dopamine transmitters in the brain. So what goes on is we give the injection of DAT scan. The body circulates that via the blood, and for some reason, it tends to accumulate in that area that I mentioned earlier, the stratum, the substantial navia. Once it's there, it tags itself to the nerve cells that produce the dopamine. and it pretty much does a piggyback. It takes a ride through the next highway, which is the putamen and the putative. And once that's done, we put the patient under the camera, and we can see if there's been activity uptake activity in that, or if there's been a lack of activity. And this is just pretty much a little image here. The little stars here represent the dopamine, and pretty much what happens is they tend to fall down here, and they bind to these receptors, and these receptors are tagged with the dopamine, and they tend to go back up the highway to get to that substantial, to the putative and the putative. Now, as we already know, the primary indication for DAT scan is to evaluate patients with suspected Parkinsonian syndromes, also with those of the central tremors. It also helps to diagnose the different other movement disorders as well. Now, there's not a long list of DAT scan contraindications, but obviously, since it is tagged with I-123, we want to make sure that the patient is not allergic to any iodine products. Also, it's recommended that if a woman is trying to get pregnant or is currently pregnant, this test not be administered unless medically needed at that particular moment. Also, this is where we come into play. And unfortunately, doctors prescribe or put an order for this particular scan, but they don't know every little detail about it. So us as a technologist and future technologists, when the patient comes in, it's very important that we evaluate the patient. We need to make sure if their symptoms are still great and their tremors are really bad tremors, if they're going to be able to lay still for about 30 to 45 minutes, which is the time it takes to do the acquisition. And the reason for that is because if they can't lay still, then that can greatly affect the image. So if you see that patient, you might want to pick up the phone and just tell the doctor that they may not be a suitable candidate for this study. Now, a little brief basic protocol for DAT scan is just like any other protocol when it comes to nuclear medicine. The first thing you want to do is you want to ID the patient. You want to verify the orders, and you want to fully explain this procedure. And the reason for that is because although we as a technologist only deal with the patient for about an hour to an hour and a half, this is pretty much an all-day process for them. So you want to make sure that they're going to be able to return on time. After we do that, we want to go ahead and also verify that the patient is not on or has stopped certain medications that may affect the results of the study. And one of them that pretty much most of us are familiar with is Wellbutrin. And unfortunately, for patients that take cocaine, they have to be off of that because cocaine is also attracted to the dopamine. We want to go ahead and let the patient know that it's very important that they stay hydrated throughout the study and up to 48 hours after the study has been complete. And once again, very important that we confirm, even though it may be written on the order, that they're not allergic to any iodine products. Once we've done that, we want to go ahead and administer thyroid blocking agents such as Lugal solution to just block that thyroid. Once we do that, we want to make sure that we administer that at least 1 hour prior to the injection of the DAT scan. And when they return back to us, we're going to go ahead and give 3 to 5 millicuries of DAT scan via slow injection. Once we give that injection, we send the patient home, and we have them return within 3 to 6 hours. Now, it's very important that at this time, once again, you tell them to stay well hydrated. And you don't want to go ahead and inject in an area that they may be having the tremors, just because that could affect the actual positioning when you get them on the camera. Now, patient positioning. This is probably the most crucial part of this scan. I had the luck of actually on one of my clinical rotations doing a couple of these DAT scans, and we actually had about 3 to 4 techs properly positioning the patient. So you can already tell how crucial this is. When you position this patient, you always have to keep in mind that this patient is going to have some form of tremor. So you want to make sure that you lay the patient in a supine position. Always use a headrest. You want to get that head as straight as possible. If the patient tends to move or navigate, try to put something there such as a blanket or something that may prevent that head from, throughout the acquisition, from going side to side. It's very important, and I know a lot of patients are uncomfortable with this, but you want to position that camera and get that camera as as close as possible to that patient. Because this is one of the tests that actually distance plays a really big role in the outcome of this. And of course, you want to inform the patient to stay as still as possible. And never ever leave the room and leave this patient alone, because as you're doing this, as the camera's going around, you always want to keep an eye out if that patient is moving, and hopefully you don't get too much of that. Now just a quick little info on some of the equipment setup. You want to always use a dual-headed camera or possibly a triple-headed camera. Always set your window plus or minus 10% of the energy peak, the energy 159 keV. You want to use a leap rotator collimator, and you want to take an acquisition of about 30 to 45 minutes. If you don't do that, you can also set it for your cameras to take up to 1.5 million counts minimum. Now, processing is fairly simple. You want to use a simple filter back projection. You want to go ahead and use either a Butterworth filter or a low-pass filter, and a pixel size of about 3.4 to 4.5 millimeters. Now, some of the potential obstacles, obviously, is patient movement. You always want to check this, the scan or the images, the acquisition, prior to releasing that patient. If, for example, unfortunately, you get a patient that moved a lot throughout the scan, you're always welcome to go ahead and take another acquisition. And if they can't stay because it's already been an all-day process, just have them return within 6 hours and you can redo the scan. Now, when I was talking about patient positioning, lateral head tilt can present a problem, and this is why. Here you have the same patient, and this is a patient with proper head positioning. As you can see, I know I haven't gone into this yet, but the images look pretty nice. Here you have the same patient with a tilt of the head, and this is a result. As you can see, the top, you don't have the same distribution of activity, or at least that's what it appears to be. So this is one of the big issues that a lot of patients have, which is why at the clinical site that I was on, they used 3 to 4 technologists, just making sure that head is as straight as possible. Now this is what a normal scan looks like. Just keep in mind, a normal scan does not mean you're clear from any of the diagnosis. What a normal scan pretty much means is that you're clear from actually having Parkinson's disease. Doctors can rule that out, but it doesn't mean that you're in the clear. This means that you might have an issue with essential tremors. And this is known as a comma-shaped scan, a comma or crescent shape. Now, abnormal scans fall into any one of these 3 categories. Now, just because one of these appear doesn't necessarily mean that you're in a certain stage of Parkinson's disease, because this is what an abnormal scan helps the doctor determine. This is just one step closer into properly diagnosing them into having Parkinson's disease. As you can see, in level 1, it appears that the activity is not asymmetrical. You have activity uptake on one side and lack of activity in the other. On level 2, you have area here, which uptake, and it's absent in the bottom portion, which is the putamen area. And in the final level, it looks like there's some type of activity or lack of activity in both regions of the brain. Now, some quick safety information. You want to go ahead and, as stated throughout my presentation, if you administer this exam to a patient who's sensitive to thyroid, to any iodine products, during the clinical trials, they went ahead and they stated that patients ended up with skin rashes. That skin does contain up to 6% free iodine, which is why it's so important to make sure you administer that thyroid blocking agent. If patients had adverse reaction, they normally consisted of headaches, dizziness, dry mouth, and vertigo, which tend to go away over time. And here's a big one. Throughout the clinical trials, women who were pregnant were not involved. So at this time, it is unknown if that skin can actually cause fetal harm, which is why if this test is needed, it's best to wait till after the woman has given birth. Also, when it comes to mothers who are nursing, you want to make sure that you let them know that it's best to stop nursing altogether, or at least for up to 6 days, because it is unknown if that scan is actually excreted through the mother's milk. But we do know that I-123 is, which is why you either want to tell them to stop or at least postpone it for a while after this study is done. With that being said, I personally think that this is something to be excited about. It's something that probably affects all of us, and the reason why, these are the famous phases of Parkinson's disease. I'm pretty sure everybody in this room can at least recognize one person up on the screen, or at least personally knows somebody who's having this disease. As of right now, there's no cure for Parkinson's disease, and they don't really know what triggers it to begin. So with the help of DAT scan, or DAT scan being introduced into nuclear medicine, it's kind of like us opening a door for patients who are suffering from this disorder. So it's constantly putting nuclear medicine, or keeping nuclear medicine on the front line of medical advancements to one day hopefully finding a cure for this disorder. And that's my presentation. If
Question. What stage must a patient be at to achieve the optimum results of Parkinson's?
There is not a particular stage. The problem with diagnosing Parkinsonian syndromes and essential tremors is that they take so long to get the first basic tremors that they're pretty far along in their process. So this is one of the stages, but as you saw in the presentation, the doctor first has to rule out certain conditions through lab work. They test the function, but it's not a limit, which is why if caught early, and that's what that scan does, if it catches it early, you can properly treat this, and just like any other condition, if caught early, you get a better result in the end for the patient.
Also, you had stated, I did notice on your contraindications, that a sedative could, why would you not utilize a sedative if a patient is having tremors while you're scanning them to give them?
Well, during my presentation, I mentioned just 3 of the common medications that the patient has to be off. Unfortunately, sedatives do fall into that category.
Oh, they do? Okay.
There's a long list. There's probably about 20 to 30 medications that the doctor has to confirm, and you have to confirm as a technologist that the patient is off. So we cannot use that, unfortunately.
Okay, I think at this time what we're going to do is to stay in